Good evening. Top emergency doctors from the Midlands say the rise in people turning up at emergency departments is now so high, medical staff are struggling to cope.
Consultants say the situation is so bad that unless something changes now, patients' lives will be at risk. Our health reporter Victoria Davis has this special report on A&E in crisis.
There's an emergency in A&E. But it's not the patients in crisis, but the department itself. Top emergency doctors in the Midlands say they're becoming overwhelmed with the number of patients arriving at their doors and are only just recovering from the worst winter and spring they've ever experienced.
This winter, for some reason, seemed to bring things to a boiling point, and there were times when my colleagues and I throughout the Midlands, and indeed in common with our colleagues throughout the UK with whom I've spoken, felt that we were operating at the absolute margins of safety.
There was no let-up. This was a daily occurrence. Patients on corridors, ambulances queuing out into the car park. We just couldn't flex to cope with that demand, resulting in multiple trusts going on major incidents pretty regularly, particularly around the West Midlands, which, shouldn't really happen.
Consultants from 18 emergency departments in the Midlands were so concerned they wrote a letter demanding urgent action from health bosses. Their fear is if something doesn't change now in the quieter summer months, then come winter, the situation could be worse.
If we have another winter where we've got 10, 15 ambulances queuing outside emergency departments, and we have emergency departments that are so toxically overcrowded that they cease to function as emergency departments, then mortality rates will rise, absolutely.
There's no doubt that pressure's increasing in emergency departments. In the last year alone, 1 million more patients were seen in A&E, but medical staff say that at least 25% of those could be treated elsewhere in the NHS. And at the Queen Elizabeth Hospital in Birmingham, doctors and nurses say they regularly see people who they believe just shouldn't be there.
I think probably my best one ever was a spot to the chin, which was quite interesting. Obviously you've got paper cuts, that's quite a common one, or painkillers, or people who've run out of medication, or high blood pressure, or a scab that might have fallen off. And to be honest, if people knew what was there, they could be seen at other places, which would prevent us having to see them. With your sling, keep it on during the day, take it off at night.
Yeah. It's open to everyone, 24 hours, and we are not allowed to say no to anyone. So they can come and they can get seen. Whatever the problem is, they can get sorted in within 4 hours.
This 20-year-old is in A&E late on a Friday night.
William McCockney.
24 hours earlier, he had an X-ray after being referred to the hospital by his GP.
Just say whatever you want.
But still concerned about his swollen knee, he says he'd rather come to the emergency department and wait 2 or 3 hours than several days to get the results from his GP.
They were going to say it take up to about 2 weeks, so I'm not going to wait that long. I'd rather get it done sorted now.
Well, I'm looking at his left knee. It looks absolutely fine. He just come back in because he felt he didn't know exactly what the result of the X-ray was, and perhaps have a little more chat, take a second opinion on his knee.
Yesterday was the busiest day the Queen Elizabeth Hospital had ever seen, with 325 patients. Doctors say some of the problem is having a rising elderly population with complex medical and social needs. But the increasing pressure and stress of A&E means junior doctors are turning their backs on this area of medicine.
If they are so overwhelmed by patient attendances and a workload that they can't cope with and that they can't safely deliver, then they will go elsewhere and they'll do other jobs, and we'll lose a tranche of people who are hugely committed to delivering emergency care but just feel that they can't. And that's my worry, that we'll lose the people who want to do this job and that we'll descend into a situation where we're not providing safe care anymore.
And ultimately that leads to deaths.
Well, that is, the worst case scenario, yeah.
All statistics point towards this winter being even busier for our A&E departments, which doctors say simply cannot happen
Otherwise, they'll no longer be able to guarantee being able to deliver safe and high-quality care. It is, they say, a very real crisis, which needs an urgent lifeline. Victoria Davis, ITV News.
So, what is the government's response to the A&E crisis? Well, we know that Sir Bruce Keogh has been tasked with shoring up the NHS.
Others, including a Leicester MP, say the improvement plans will come too late. Our political correspondent Alison Mackenzie reports.
The NHS is a huge organisation facing huge challenges. In response to our report tonight, the body responsible for accident and emergency, NHS England, says 95% of patients in A&E in Midlands Hospital are seen within 4 hours. But as to the future, they're looking to the review currently underway by Professor Sir Bruce Keogh. Sir Bruce Keogh, the National Medical Director, is consulting on the best design for a new system which will simplify and replace the current A&E system, which is clearly not fit for purpose. He will call for better integration between health services that provide care for urgent cases. It's unlikely to be a one-size-fits-all model. This was the response today from the government.
We need to look at the whole system, not just at A&E, and identify what the pressure points are and how best to address them. We're freeing up money to do that, but more importantly, perhaps for the longer term, it's a case of GPs, hospitals, social workers getting together to see how collectively they can solve this problem for the longer term.
But the Leicester MP and Shadow Health Minister Liz Kendall is calling for action, not words.
The government says they're reviewing the A&E crisis, but their plans won't be implemented until spring next year. We need to be focused on this coming winter, where there are going to be real problems unless action is taken. They need to speed up, get a grip.
There is no one simple solution to the crisis. It'll be a complex mix of meeting the needs of an ageing population, a growing population. The A&E system as we know it was invented in 1948. This is 65 years on. The replacement will be slow in coming and politically sensitive. Meanwhile, the pressures continue to grow. Alison Mackenzie at Westminster for ITV News.
And there's much more on the A&E crisis across the country's hospitals on ITV News at 6:30 tonight. Mary Nightingale will be presenting the programme from Birmingham's Queen Elizabeth Hospital. Plus, of course, as ever, more coverage on our website.
Meanwhile,